Hello, welcome to today's episode of Campus Health here on ATU TV with me, Maristella Sekle, where we give you health updates. So today the show is going to be quite different from the usual one. I have with me a co-host, Ayite Gideon, who will be helping us to understand certain things that are done in the hospital and why they are done. You're welcome, Gideon.
Thank you very much,
It's been a
Maristella.
while.
Yes, it is. It is. It is.
Nice to have you today.
Nice to meet you too.
Okay, so moving straight to today's agenda. Have you been to the hospital before?
Yes, on countless occasions.
Okay, were you an outpatient or you were
Both,
admitted?
both admitted and outpatient.
Okay,
Yeah.
all right. So on admission or when you went to the hospital, did you receive any injection?
Yes, I received an injection. Yes, I think about 3 injections.
Wow.
Yeah.
So have you seen the nurses raise the syringe and then they do something like this?
Yes,
Have you
I've
ever
I've
seen them
noticed
doing
that,
that?
but well, I could see that maybe it's because of their profession. There are some techniques they have to do.
You don't think they are
Yes.
trying to scare you? Because when you look at how long the needle is, don't you think they are trying to scare you?
Yeah, at a point in time, I was scared. Like, why would the nurse raise up the syringe and be tapping on it, like to scare me or something like that? Yeah.
Okay, so the actual rationale or the reason
Mhm.
behind them doing that is to just expel air from the syringe. So
Oh, I
when you
see.
withdraw medicine, air enters. So they
Okay.
just tap it to expel the air so that they can get accurate measurement of the medication or so that they don't inject air into the person.
The
So
person.
that's the
Okay.
reason.
So, what's the implication of a nurse injecting air into uh, a
So,
patient?
so for example, when air enters your
Mm,
bloodstream, it
mm,
can travel to your heart, or what it forms what we call embolus. So
okay.
when that embolus enters your system, it can go and cause other health implications. You may
Implication.
develop difficulty breathing and other things. So we don't
Okay.
want air entering into your system, and we also want to
Okay.
get accurate measurement of the medication. That's why we tap it.
Okay.
Okay.
All right. All right.
All
Thank
right.
you.
So the next thing is you've received an infusion before, right?
Yes, I have.
And you see them pouring some away, like they connect the infusion and then they pour part of it away. Don't you think we are wasting your money?
Well, yeah, I thought about it, but as I said earlier on, I presume that maybe it's because of their techniques they use in their professional field. Yeah.
Excuse me. Okay, so the reason we do that is just like the needle
The
thing.
needle.
So
Okay.
when you connect, there's a line that we use to connect the the infusion.
Okay.
So when you connect it, there's air inside. So we
Mm.
normally flush it with part of the infusion so that
Oh,
we don't infuse air into your system.
into the
So it's
system.
not like we want to waste your medication.
Okay, let me add another question. When you are being given the injection,
Okay.
the nurse would put an injection like into your cannula.
Okay.
Yeah, like will infuse some of the sample taken out of the infusion, yeah, into your cannula. So why do they
Oh,
do so?
okay. I get your question. So when we set the cannula,
Mm,
okay, blood comes out, and
okay,
sometimes the blood may clot. So
okay.
we take part of the infusion and then
Infusion,
use it to flush the line
flush
so
the
that it
lungs.
doesn't easily clot.
Okay,
That's
okay.
why it's done.
And sometimes too, I don't know how the cannula is being done,
Okay.
but sometimes when the nurse or the doctor inserts the cannula, you feel pains at your elbow area. You'll
Okay.
be feeling
Where
some
it's being
particular
inserted.
inserted.
I mean,
Yeah.
it's a foreign material that is being put in there. So
Okay.
sometimes trauma. So maybe the person tried and didn't get
Mm,
the line, tried several times. So you may cause trauma to the surrounding tissues. And
okay.
also the cannula itself is a bit painful.
Painful. Okay.
Yeah.
But I've seen it's not a needle. It's
It's
something like a
plastic, but it
plastic
has needle inside.
inside.
So after it's insected, the needle is being brought out. Then
Okay.
the plastic
That
is left
is left
inside your
inside.
vein. All right. So tell me about your worst experience at the hospital.
My worst experience.
Have you
I
ever
quite
had any worst experience?
yes, I have a lot. I have a lot. So let me try to recall some of the experiences. Okay, I've remembered one.
Okay.
I remember I was extremely ill and I was vomiting,
Mm.
like green and yellow.
Okay.
Yes, so like the nurses there haven't seen such incidents before. That was the first time they were seeing. So
Are you
like
sure?
yeah, I
I
could
mean,
see from their faces.
like they've not seen you before, or they've not seen such a case before.
Yes, they've not seen such a case
Wow,
before.
that's interesting.
Yeah.
And
Maybe they've seen some, but maybe it's because mine is a bit extreme. That's why they were.
okay, so what happened?
Yeah. So the incident was that uh, the way they were looking at me, like
Mm.
I'm the patient and I'm weak and I'm vomiting at the same time, and at the same time, like I don't know how to explain
Okay,
the situation, but when I say like you understand how,
so you
yeah,
felt they didn't attend to you promptly, or
yeah, promptly and at the same time, looking at the situation whereby I was vomiting, like the way they were looking at me, like the kind of eye contact they were giving to me, like I wasn't okay with it.
oh,
So
that's so unfortunate.
yes,
I
so that
mean,
was my worst
in
experience.
actual sense, when you go to the hospital, sometimes people may even be there before you get there. But looking at the severity of your condition, the nurses would have to attend to you before those people, after explaining to them that you need urgent attention. And
Okay,
that's what we call triaging.
okay,
Okay.
okay, okay.
All right. So, when you were on the ward, when you were admitted,
Yeah.
you realize that they ask your relatives not to sit on the bed.
Yes,
Do
I've
you
not.
feel offended?
Yeah, I feel offended because in my home, if I'm sick or I'm ill, my mom will come and sit on my bed and
Mm-hmm.
sometimes place his hand on me and check whether
Then
my temperature.
your mommy's boy.
Let me see, like
Oh, okay.
yeah, place her hand on me to
Mm-hmm.
check my temperature and all that. So at the hospital that my mom is being restricted not to sit on the bed, I feel offended. Like,
Oh, okay.
yeah.
So, reason why we don't allow patient relatives to sit on the patient bed is because we don't want cross infection, either from the one coming in or from you. So at the hospital, we have what we call nosocomial infection. So we
Okay.
don't want you sitting on the patient bed so that
Mm,
you don't take that infection to the
infection to the
house
house.
and go
Okay.
and infect other people. And we also don't want the situation where you bring something from the house and come and complicate the case
The
that we are
case.
managing. So
Okay.
that is why. It's not because we don't care about your relatives or anything.
Okay.
You
But
get,
sometimes some of the behaviors of the nurses, they have to explain to our parents and
yeah,
yeah,
I get
that
it.
this is the situation, but they don't tell them. They'll just tell the relative or the guardian that's with you that
Mm-hmm.
please don't sit there.
Mm-hmm.
Sometimes it's rude to
Okay.
say to somebody
So
to say to
I
them.
think the nurses and the healthcare providers are listening will do better to explain
Yes.
to you some of these things.
Yes.
All right. So do you have some questions for me?
Okay, I think have about two questions to ask.
Okay.
When you go to the lab,
Mm-hmm.
samples are being taken out of your body,
Okay.
and mostly is blood.
Mm.
And sometimes the amount of blood being taken out of your body, you could tell that this particular blood will be sold. So
Ah!
yeah, because looking at sometimes the syringe will be full, and even they will even add
Oh
another one to it.
no. So the what happens is that every test has the amount of blood that can be used to run it. Okay.
Okay.
The amount of blood that will be used for normal testing of your blood level is
Mm,
different from if they want to check your kidney function and all
mm,
those things. So they take the sample depending on the labs that will be done. And the sample that is taken is not enough to cause you to have shortage in your blood or what we call low HB, and it's not enough to even be sold.
mm.
If you are taking blood for transfusion, it's taken differently. It's not taken with the
The
syringe.
syringe.
So
Okay.
please, we don't sell your blood,
Okay.
okay?
So after
Once we are done with the test, it's been thrown
thrown
away.
away.
Yeah.
Okay. All right, understood.
All right. So nobody sells your blood, okay?
Okay, all right.
Next question.
So another question is that a patient is weak, a person is in an emergency situation,
Okay.
but the nurse at the clinic or the hospital doesn't show unconcern. Sometimes he or she will be watching TikTok videos,
Wow.
scrolling on the phone whilst the patient is seated, waiting for the nurse to attend to her. Are there sanctions to those nurses or
Okay.
reports that maybe as a patient, when I see such situations, I
Mm-hmm.
can report to authorities?
Okay, so every hospital has their protocol, and I believe Ghana Health Service also is not in support of such behaviors from healthcare providers.
Okay.
But depending on the hospital you visit, you need to
Mm.
talk to their administration, or every
Okay.
hospital has their form of the way they lodge their complaints.
Complaints.
So
Okay.
you lodge the complaint to the nearest authority, and
Okay.
that will be addressed. Something like where I worked, once you get to work, the only time you can use your phone is when you're having your lunch at the canteen.
Mm.
So if you call me during working
Work
hours,
hours.
you may not get me.
Okay.
So it depends on the hospital, and it's rather unfortunate that today the social media and the internet is causing a lot of harm, that we are losing our empathy or our professionalism as healthcare professionals. But
Yes.
I believe that there are better days and we'll do better.
Yes. Yes. Another question. Why is it that doctors taking care of us don't mention their names to us, but they know our names? And another one, another top up question.
Let me.
After lab test,
Okay.
the result that comes, unless you ask the doctor before
Mm,
they tell you that this is what you've got, this is the infection you've gotten,
mm,
so this is the treatment I'm giving to you.
okay.
Yeah.
Thank you very. This is a valid
Mm,
concern.
mm,
This brings us to what we call patient charter.
mm.
So the patient charter is a document that outlines the rights and responsibilities of both the patients and then
And
the
then the
healthcare providers.
professor, okay.
So let's just, since you are asking for the patient, let's
Patient, yeah.
focus on the
The
patient.
patient, okay.
So the patient charter actually gives you, the patient, the right to
Mm,
know the identity of your caregivers. So if you go
okay.
to the hospital and we don't mention our names to you,
Mm,
you need to ask.
okay.
So you need to ask and even get to know our qualifications.
Okay.
So
Okay.
let's say you meet me at the hospital. I'm supposed to tell you, hey, I'm Marie Stella. I'm a doctor or I'm a midwife,
Okay.
before I even start
Starts,
attending to you.
yes, yes.
So if that's not done, you need to ask.
Okay.
Then the same patient charter spells out the fact that you need to know your diagnosis
Okay.
as a patient.
Okay.
So we are supposed to tell you that, oh, this is wrong with you, you have malaria, and discuss your labs with you. But if we don't do it, you have the responsibility as a patient to ask.
Okay.
Yeah.
So this comes back to our campus here.
Okay.
Most of the times when students are being admitted
Mhm.
into the institution, you go under medical screening and all
Okay.
that. They take samples and all that. But after the process, you are not being given your result to know this the
The
illness, the
outcome.
outcome of everything.
So I believe the school authorities
Authority
of
there,
Accra Technical
University.
University is watching. This is a concern raised by one of your students. So I think that this should be taken up going forward. The student deserves to know the outcome of their lab results and whatever screening is being done on them. So I believe they'll take it up.
All right, thank you very much.
All right, so rounding up, I'd like to ask, what is that one thing you wish changes at the hospital?
One thing.
Yeah, one thing that changes at the hospital.
Okay, I wish we adopt the health system of US and UK,
Okay, tell
because
me about it.
when a patient is approaching the hospital, the
Mhm.
care, the love the nurses show to the patient, even you, the patient entering the hospital, will be healed completely. But
Wow.
here in our country, you get to the hospital, you even go and take stress and another health implication upon yourself and send it back to your house. So I think that's
That's one
the
thing you
one
wish to
thing I
change.
wish to change
Well,
if
I
I have the
believe it
power.
doesn't have to be UK or US before we do better.
Yeah.
You should also know your rights as a patient, know your responsibilities, and demand for it
Okay.
if it's not being given to you at
Okay.
the hospital. And I believe a lot of hospitals are in Ghana are doing well.
Yeah,
I
a lot
mean,
of them,
yeah,
but
they are.
most.
Yeah, so they are doing well. It's just about attitudinal change. Like
Okay.
it's about individual differences,
Differences.
healthcare professionals becoming more professional and sticking to the code of ethics of the profession
Profession. Okay.
so that they can deliver excellent service. We don't have to go to the US
The
system or
UK.
we can be in Ghana and still experience quality healthcare.
Okay. All right.
Do you
Then
agree with me?
I agree with you to a certain point, but to some extent I don't agree. But let me take it like that.
All right.
Yeah.
Okay, so Gideon, thank you very much for joining me on this session.
Yeah,
It's
welcome.
been very insightful. Thank you all viewers for watching today's session. And this is Campus Health. See you same time next week. My name is Maristella Sekle.